So, every October, we talk about the breast cancer awareness, we talk about pink ribbons, and talk about screening. But today, I'm going to tell you a story. The story of one of my patients. And I'm going to make this as a tribute to her. So, in 2021, I met her, Ellen, and she came into my clinic with her husband. She had had this breast cancer for several months, and as usual in Nigeria, people who had no idea of the disease had been given different kinds of advice. They had been saying, use this, use that. Don't go to the hospital, because if you go to the hospital, the doctors will only make it worse. So she came in late. At the point she came, it was already a stage 4, meaning that it had spread to other parts of the body. She came in so calmly, even though she was in so much pain. So I looked at her, trying to choose my words carefully. I counseled her and her husband extensively about what the issue was and what the plan was. I told them there were no certainties, but the options of care included chemotherapy first. Then there were other modalities of treatment. Now, chemotherapy, here it is. Most times, when patients come to see me in clinic and I mention chemotherapy, their first response is, no, doctor. People have told me if chemotherapy is given to anybody, that person is going to die. And I wonder, who are the people spreading such misinformation? Why do you spread misinformation? Why do you spread information you know nothing about? And my question sometimes is, if I meet you on the road, nothing is wrong with you, am I going to call you in and give you chemotherapy like an anti-malarial? The answer is no. Why am I giving you the chemotherapy? Does cancer kill? The answer is yes. So why do you now tell someone that the treatment or one of the modalities of treatment for something is going to kill the person, when that thing itself is going to kill the person? Can we stop giving false information? If you are not sure of what made someone die, don't say it is because of chemotherapy. Alright, so I'll probably deal with that separately. I'm telling a story. If you want me to deal a little bit more with the issue of chemotherapy, drop your comments below. So, after counseling the patient and her husband, they agreed to start treatment. She already had locally advanced disease too. First cycle of chemotherapy, second, third, fourth. By the time she had had chemotherapy for 3 months, she was a different person. She could now stand, walk around without pain. It wasn't easy, but every time she came in, she had that smile. She became someone who was encouraging other patients not to give up. And somehow through faith, science, and sheer will, she did improve. Pain disappeared. She gained weight. And she then had surgery. Now, remember, in metastatic disease, that disease that has spread, surgery is not primary treatment. But sometimes we give patients that option of surgery in the event that the tumor progresses. the patient's quality of life is better, so they don't have wounds and all that on the chest that they have to be dressing every time. All right, so we felt that we should offer surgery, so she had surgery, and then after surgery she continued her chemotherapy. This same chemotherapy that some people said would kill her made her better. After her treatment, after about a year or so, she was completely fine. We sent her for radiotherapy. She had her radiotherapy. And she was completely well for the next 2 years. She went on a missionary trip with her husband, far away in Nigeria. They would go on a boat, go to very far interiors, and they did what they wanted to do. She had periods when she came back on follow-up, and I remember people would tell her, "Where are you going?" When she explained that she needed to see a doctor, they were like, "Which doctor do you need to see? You, everything about you is fine." You see, sometimes we don't recognize that people are going through battles. They're saying, why are you going to see your doctor? Which doctor? Okay, can't you see a doctor here in the village? What is the big deal that you have to go back to Lagos to see your doctor? But she kept coming and going. Everything was well. 2 years after, like I said, she developed a relapse, and she developed fluid in her lungs, so she had to come in on admission. Fluids were drained. She had more chemotherapy after that. Fortunately, she recovered again. Month after month, she kept defying the odds. Every time she came in for a review, she would say, "I'm still here, doctor." And of course, she became a symbol of hope in the clinic. People would ask after her, say she's fine. She conducted a number of interviews, and everybody was happy. After another 1 year, 1.5 years, she came in with another relapse. The tumor in the liver had now become more extensive. We could no longer give her chemotherapy again because I felt she was really not so strong anymore. So we just decided to treat her conservatively. There were other options or some molecular targets that we could have given her, but these were quite expensive. This brings me to another problem, especially in these climes. Government needs to do more as regards getting some of these expensive medications. In other clients, patients have access to these drugs just on insurance, but these drugs are quite expensive if you want to get them out of pocket. So she could not afford it. There were a number of people that were willing to help, but everybody has their own challenges. Despite all, she kept a positive attitude, very positive, very strong. She would come in and out of hospital, have different kinds of treatment, but of course we knew that she was going down. Counseled her and her husband many times about what else we could do. So that fateful evening when the husband called me that she collapsed at home and she was brought to the hospital, and the doctor said she was no longer breathing. Took a deep sigh, and I knew she had fought the good fight. Interestingly, that evening when she collapsed, she was cooking. That tells you the kind of resilience. She would always tell you, "Doctor, don't worry." She would tell her husband, "Don't worry, I'll stand up. I'll do it myself." And so this is a tribute to her. Um, because every single day she lived, she fought for her family, she fought for her faith and her dreams. And for me, it was a reminder that medicine may treat the body, but courage goes a long way in healing the soul. Breast Cancer Awareness Week, I want you to remember a story, because behind every statistic is a woman with dreams, laughter, and courage. Early detection saves lives, but even in advanced cases, hope matters. Remind every woman beside you, regular breast self-examination and screening is quite important. I usually tell patients, because the breast is on the outside, it's quite easy to detect problems with it. It's either you detect it yourself early, or when you go to the hospital, it will be detected early. It's different from some of all these other cancers that are quite hidden. You might not be able to detect on your own, and even when you go to the hospital, it might still not be detected on time, but the breast is on the outside. Please, I say again, let us avoid giving wrong information. Let's avoid putting unnecessary fear in the lives of our women and telling them not to accept treatment. Please. Together, we can fight breast cancer. If this story touched you, please like, share, and leave a message of encouragement for every woman fighting breast cancer right now. I'm Dr. Elemile. Thank you for watching. Cheers.